Dear students, we'll discuss a test, a clinical test, which is mainly important for you because you have to demonstrate in oxy, in short case or in the long case, whenever there is a fluid while examining a swelling. So what is this? What is this clinical test is? Somebody is holding, see the scrotum holding like this. So details I'll show later. So this is fluctuation test. It is a eliciting transmitted fluid movement or impulse in two planes in right angle to each other. So right angle to each other you have to elicit always. Fluctuation you have to fix the swelling. Then in the two direction you have to elicit. If you elicit only one direction, it is not called as fluctuation. So you have to press one side, that is called displacing finger. Then you have to feel. Elevation you have to feel, that is called watching finger or perceiving finger. Displacing finger is active, watching finger or perceiving finger is passive. So unless you fix the swelling, you won't be able to elicit it. Fix it with these two fingers, press it like the great elevation, then in the perpendicular direction you have to do. So always you have to do in two direction perpendicular to each other. Always you should be able to fix the swelling, and you should then press one side, they're called active finger, displacing finger. Then you get elevation on the perceiving or watching finger. So prerequisite is fixation, fixing the swelling, and you have to elicit fluid movement in perpendicular to each other according to the Pascal's law. So that is the exact meaning of fluctuation test. When the swelling is soft, you have to elicit fluctuation, and if it is positive, that means it contains fluid. It means it is cystic. So before telling any swelling cystic, you should be able to elicit fluctuation, positive test. If it is not fluctuant, you will not tell that swelling is cystic. There are exceptions in the abdomen. In the abdomen, by principle, you cannot elicit fluctuation because you cannot fix the swelling. You cannot do that. That's why you can't elicit. Except hydrated cyst, you can elicit a 3-finger test. Press here, percuss here, then you get the fluid movement on other 2 fingers. So that is only for hydrated cyst. Otherwise, all abdominal mass fluctuation test you cannot be elicited because you cannot fix the swelling. So prerequisite is you have to fix the swelling. And again, remember you have to do in two directions perpendicular to each other. That's how exactly you will do it. So already told, displacing finger, perceiving finger, watching finger. Another test, if a small swelling is there, you won't be able to fix it and elicit the fluid movement in two directions. Swelling is small. In that situation, hold like this, then press over the summit, or with this like this. Hold with the one hand, 2 fingers, then press indent over the summit, where your finger get yielded. You can feel the fluid movement, the finger get yielded into the swelling. So that yielding sensation, very typical, is of Paget's test of fluctuation. It's called as Paget's test of fluctuation, done in a small swelling. That is also very important, often asked in MCQs, Viva, Oxy, or clinical examination, short case. You have to know, you should know how to do it. So this is Paget's test of fluctuation. Paget's test of fluctuation, remember. So this is how exact you will sit, fix the swelling, do it in two directions, perpendicular to each other. So fix it, do it like this, do it in perpendicular. So two directions you have to do this, important. That is called Pascal's law. And fluctuation suggests what? Fluid content. So swelling is cystic in nature. And once it is cystic, you have to always do translumination. Next test you have to do is translumination. Focus the light over the swelling through a pen torch, and if it eliminates, that means content which we thought, because of the fluctuation test as a cystic is considered to be tonsil element, means it contains clear fluid. So if it is tonsil element, it contains clear fluid. If it is not tonsil element, swelling does not contain clear fluid. So if it is cystic, if positive fluctuation test, I always makes you to do next step is transillumination test using pen torch. So prerequisite swelling should be fixed before listening fluctuation test, I already told. So just see a small video here, how exactly fluctuation fix the swelling. Then two direction you do it, perpendicular to each other. See that I'm showing properly, perpendicular to each other. It's in hydrocele case, large hydrocele. It is fix the swelling with the 2 fingers, it is fixed. Then in a two direction, see that in a two direction you have to do. That is exactly, that video shows very clearly. Fluctuation test is very important test. Go through my SRB clinical methods in surgery, swelling chapter detail, it is given, and video also there in that video, how to examine swelling and also go through my SRB manual of surgery for learning entire surgery aspect. These 2 books are more than sufficient. And again, I am requesting you to subscribe my channel. It contains daily brief lectures will come in the YouTube for 5 to 10 minutes. Case scenario mainly, sometimes images, sometimes instruments, sometimes brief operative procedure, small videos. So different versions of the discussion daily. So it will increase your knowledge about surgery day-to-day basis. This small video, so small time if you spend, that is sufficient. Of course, it contains MCQs, 2 MCQs, and with the quotation that also enlighten and increase your knowledge about different subject, different topics. And also live sessions will have at regular intervals about the different aspects of the clinical aspects in the surgery, like hernia, swelling, peripheral hypertrophy, varicose, mass abdomen, different things. So students will present live with their, other than me, senior faculty will be there online in the platform, so that you'll have extensive discussion more than an hour. And you can always join and put your question out in the chat box and get the answer back. And if you join live, you will get a certificate which will be very helpful for to you in your future career. So also, so I again request all of you to subscribe my YouTube channel and like it, and press the bell, and also share with your friends, colleagues, and other faculties or other students, so that they also can have a idea about the surgical, different surgery or knowledge, or upgrade their surgical knowledge day-to-day basis. So again, I'm requesting to subscribe my YouTube channel, dear students. So answer the MCQ. I appreciate, acknowledge your answer. Put it in the comment box. So compressibility is seen in lipoma, secretion dermoid, neurofibroma, hemangioma. Put the right answer. Again, another MCQ. Swelling which is not fluctuant is hydrocele, epidermal cyst, lipoma, ranula. Again, put it in the comment box. So quotation of the day is: loyalty is a responsibility, not a choice. If you are working somewhere in some system, you should be loyal to that system. If you are not loyal, leave the system. It is whatever it is, should not bother about what you are paid. But once you are there, you should be loyal. That is what exactly it is. So it's very, very essential, especially to build up a nation, build up a system, build up an institution. That's why this quotation is very, very important. So students, go through my SRB's Manual of Surgery, current edition. It covers everything about given in the CBME syllabus: general surgery, gastrosurgery, specialties, urology, cardiothoracic, neurosurgery, and it contains instruments, brief operative surgery, anesthesia, and general surgeries like thyroid, breast, salivary glands. Everything it is covered, which will be sufficient for students to learn. With the MCQs are there online in each this one. Lot of illustrations and photos are there. And also my clinical methods in surgery, current edition, use a very good clinical approach to how to examine a patient with a lot of photos, with the differential diagram in a tabular form, so that it will be very useful for with the case sheet how exactly to write everything, with the history taking. It will be very useful for you, for students to face a practical exam, long case, short case scenarios, oxy, and other things. But it does not contain management aspects. A clinical book, which has got a video for each chapter how to examine a patient, and that is so very, very useful book like SRB's Manual of Surgery. My operative surgery book, new edition has come, third edition. It has got a 2-volume. It was extensively discussing all procedures, major, minor, with the illustration photos. More than 10,000 photos are there. This you can go through it. And my Atlas of Tissue Approximation, which shows a small atlas, 100 pages. It was how exactly, with the video it shows how exactly to do suturing in different levels: skin, subcutaneous, deeper level, muscles, and bowel, other areas, laparoscopy, suturing, everything. It's given a very detailed principle, with the principles it has given. So you can always go through it to improve your skill. Also, my DigiNow lecture through JP Publishers, around 220-hour lecture is there. It covers everything, whatever in the CBME syllabus, properly with the PPT presentation, and also clinical methods also with the video, and operative surgery briefly, and specialties also briefly, instruments, X-rays, specimens, other images, everything it is covered. If you purchase for a year, it will be very, very useful to learn and go through and face the all exam, including NEET. So please purchase the DigiNow my lectures for that purpose. And also, students, again I am requesting you to subscribe my YouTube channel and other channels, and also like the channel, like the video, and press the bell button, and also share videos to others, to your friends, colleagues, so that they also have the better knowledge about the SHD as a day-to-day basis. Again, I am requesting students, please subscribe my YouTube channel. So, students, I hope you have understood this lecture very well. Thank you so much.